This is your daily reminder to trust women and trust their assessment of their pain. I had a patient recently that I was doing a hysteroscopy for as a diagnostic procedure to take a look inside the cavity of their uterus to assess their infertility diagnosis. Hysteroscopy is a procedure where we place a camera through the cervix into the uterine cavity while we're putting fluid inside to see really what's going on inside the cavity of the uterus. This patient had had a saline ultrasound the week prior, and there were some concerning findings, and so we wanted to take a closer look, right? So these can be uncomfortable procedures. I do many of these, and I would say about 90% of people feel like period cramps, maybe a little bit more intense, maybe a little bit less intense. Some people feel nothing. Some people it is much more uncomfortable than that and outright painful. So I did this procedure and I diagnosed the patient with a uterine septum. And this is something that needs to be surgically corrected prior to pregnancy because there's a risk of recurrent pregnancy loss or preterm labor, breech presentation, and placental abruption. Now, this patient started crying after I finished the procedure and was talking to her about having a uterine septum. And I asked her, I'm sorry, are you still uncomfortable from the procedure? What can we do? Can we get you another hot pack? Like, what can we make you feel better? And she said that she wasn't crying because she was in pain. She also wasn't crying because of the diagnosis of a uterine septum, the other thing that I would have thought maybe could have caused this crying. She was crying because in the past, she had an IUD inserted and she had excruciating, unbearable pain. And she was told that this was normal and that was pain that would have been expected during an IUD insertion. I had just done a potentially painful procedure for her. I had just diagnosed her with something that's going to further delay her to a successful pregnancy. And the reason why she was crying was because I validated that this uterine septum could have been the cause that her IUD being inserted was so painful when she had thought that she was crazy because of the way that providers responded to her. A study recently came out about the experience of care and gaslighting in patients with vulvovaginal disorders, including pelvic pain. Half of these patients considered stopping care because of their experiences. 40% said that they were made to feel crazy. We need to be better